If you're over 40 and your blood tests look normal, you probably think your heart is fine. I thought that too. But what I didn't realize is this. Blood tests don't tell you whether plaque has already started forming in your arteries. And by the time symptoms show up, the opportunity to prevent real damage may already be gone. In this video, I'll explain the blind spot I didn't know existed and why relying on blood tests alone almost gave me a false sense of security. Most people believe that if their blood work looks okay, their heart is okay. That belief makes sense. You have your annual physical and you get lab work done and your doctor says everything looks normal and you move on. But that belief is exactly where the blind spot in heart health is. Blood tests don't actually show what's happening inside your arteries. That matters because a lot of people have normal labs and still develop plaque in their arteries. Blood tests estimate your statistical risk, but they don't confirm whether structural changes have already occurred. And here's what most people don't realize. The system is largely designed to manage disease once it's visible, not to routinely confirm the absence of early disease. If you're over 40, that gap matters. Later in this video, I'll explain to you how I personally fell into that gap, even though I thought I was doing everything right. But first, you need to understand what blood tests can and can't show you. If you're proactive about your health, your routine lab work probably looks familiar. You get your annual blood work done and check your cholesterol, you check your blood sugar, and you probably check your blood pressure. And if nothing is flagged, you assume you're good to go. To be clear, that's not irresponsible because that's what most people are told to do. The problem is that blood tests are often treated like the final answer when they're really just the starting point. Your doctor isn't hiding anything from you, but you're not getting the full picture either. And this is where most people unknowingly stop asking questions, which can become problematic later. Here's the simplest way to think about blood tests. They don't necessarily tell you whether you have artery disease or not. They mostly tell you whether you might be at risk of developing it. High cholesterol doesn't equal plaque in your arteries, and high blood sugar doesn't mean you have clogged arteries. But even normal numbers don't mean your arteries are clear. Blood tests are probabilities. They're forecasts. Think of them like the weather report. They tell you whether the conditions are favorable for a storm, not whether it's already raining where you're standing. And after 40, that distinction becomes critical. So why doesn't the system go further? Why aren't people routinely offered deeper testing? This is because the healthcare system is largely structured to diagnose and treat disease efficiently, not to confirm low risk in people without symptoms. Doctors follow protocols. Insurance reimbursement is largely aligned with treatment, not reassurance. Advanced testing is usually only recommended only after symptoms show up or after extreme lab results, but not before. It means the system is reactive by necessity and structure, and the consequence is that you can quietly accumulate risk for years without even realizing it. That's the blind spot, and that's exactly where I found myself. About a year and a half ago, I found out I was pre-diabetic, and to be honest with you, that shocked me because I thought I was in pretty good shape. I was active, I ate reasonably clean, I was carrying a few extra pounds, but I didn't think I was grossly overweight. That was a wake-up call, and I took it seriously. So what did I do? I cleaned up my diet and I lost fat, my A1C improved, and by most definitions, things look better. But when I started to dig deeper, I discovered something that completely changed how I thought about heart health: advanced lab testing. These tests are not a part of routine screening. My lab test revealed I had elevated ApoB and insulin resistance that wasn't obvious on standard labs. I also found out I had something I'd never heard of before: elevated Lp(a). Elevated Lp(a) is a genetic risk factor that puts me at an increased risk for cardiovascular disease. Now, these markers didn't mean I was sick. They meant I had been exposed to risk for a long time without knowing it. Because I had elevated Lp(a) levels, I was terrified by the thought that, has this already caused irreversible damage, or do I still have time to do something about it? Blood tests alone couldn't answer that question. Up until this point, I still didn't know whether I had any risk that it turned into damage, and this is where imaging comes in. Tests like a coronary calcium score or a coronary artery ultrasound. These tests don't predict the future, but they do answer a different and often more clarifying question: has plaque already started forming in my arteries? Not whether I will have a heart attack, and not whether I should be on medication, just where I'm at right now. That clarity doesn't tell you what to do, it tells you what you're working with. and that information can strongly influence how proactive or measured your prevention strategy becomes. Now, fortunately for me, my calcium score came back clean with no calcium deposits in my heart arteries, and my carotid artery scan revealed I only had minimal soft plaque present, which was normal for my age. So who should be thinking about advanced testing? If you're in your 40s, this is about awareness and course correction. This is where problems often begin quietly. And if you're in your 50s, this is about confirmation. Don't assume that time has been kind just because your labs look okay. And if you're in your 60s, this is about clarity. And relying solely on assumptions becomes increasingly risky. Silence at 45 can become opportunity. Silence at 65 equals uncertainty. And the longer uncertainty persists, the more limited your options may become. The biggest mistake people make is assuming that no news is good news. It isn't. It's just unanswered questions and ambiguity. No one will advocate for your long-term health better than you will. Learn what standard tests can and can't show, and ask better questions early. And don't assume that normal is safe. If this video made you realize that blood tests don't tell the whole story, the next question is why these problems start in the first place. I have another video where I break down insulin resistance, the silent metabolic process that drives most heart disease long before symptoms appear. Like I said, no one will ever be more invested in your long-term health more than you. Understanding what questions to ask and when is often the difference between reacting late and acting early. I hope this video helped you think more clearly about your health, and thanks for watching.